Now, the World Health Organization today launched a campaign to raise awareness and spur action for suicide prevention in the African region, which has the world's highest rates of death by suicide. Around 11 per 100,000 people in Africa die by suicide every year, higher than the global average of 9 per 100,000 people. Now, this is due in part to insufficient action to address and prevent the risk factors, including mental health conditions which currently affect 116 million people. The launch of the campaign comes as Kenya joined the world in marking this year's World Mental Health Day.
As Kenyans across the country gathered in different places to mark this World's Mental Health Day, in Kisii County, one woman was reminiscing on her long journey and struggles with depression. Gladys Gesare, a middle-aged divorcee, is one of thousands of Kenyans dealing with one form or the other of mental health issues. Her problems started within the family unit.
Wakati mume wangu alipokuwa akinifanyia madhara yote, na sitasema kuwa alinipiga. Yangu nimesema ilikuwa ni kupigwa kiakili. Ile mtu atakugombeza, atakutusi, atakufanyia vituko, lakini baadaye unapojaribu kuuliza atarudi na zawadi mingi, hata kama ni gari, alafu unapoa. Lakini unaona unapopoa bado ile chuki yenye uko nayo ndani yako ama ile uchungu kwa ndani yako bado haujautoa.
Her marriage on the rocks disintegrated, leaving her without a business, her husband and her children. Life lost its purpose and depression set in. Only that she didn't know it then.
Mimi sikuwahi jua kuwa niko mgonjwa, sikujua hadi wakati sasa dawa nilipewa ndio ninaendelea kumeza. Na sikuwahi jua hizi dawa ni za nini. Hasa mpaka wakati nilianza kuona therapist, ndio akaniuliza ni dawa gani hizo, nikamuelezea. Then akaniambia ni hizi.
She has since identified what was ailing her and is on the road to mending. She is amongst a small fraction of those who have sought and received help. Health practitioners say many like her either do not know they have mental issues, or if they do, they do not know how and where to access help for these cases that registered huge increases, especially during the COVID-19 pandemic period.
We realize that mental health is actually a challenge that is real and cuts across the community. And while on duty, we have come to realize that mental health has not spared any sector. Almost every other sector today has been affected, and mental health issues or challenges.
The World Health Organization says resources needed to handle mental health care issues across the globe fall short of the demand of these crucial services. This is true in Kenya. A report of the Task Force of Mental Health in 2020 indicated that 75% of Kenyans are unable to easily access mental health services. The report further shows that mental illnesses like depression and suicide, substance use disorder, bipolar disorder, schizophrenia, and other psychoses account for 13% of the entire disease burden in Kenya. Yet, there were only 0.19 mental healthcare professionals for every 100,000 Kenyans in need. These professionals are found in 29 out of 284 level 4 and above hospitals in Kenya, aside from Mathari National Referral Hospital.
Require for the government to do is increase, if they have, actually maybe there's been no budget for mental health in the health budget that has been there before. So if there's been no mental health budget, now we need them to adapt a mental health budget that will incorporate buying modern medication for patients. One of the things that our patients suffer and they fear coming back to the hospital for mental health services is that they get medication that even make them feel worse.
To bridge the gap in the resource challenge, stakeholders now want the national and county governments to increase the allocation for mental health care budgets from the current 15 cents to 150 shillings killings per capita. The stakeholders also want the government to move with speed to change the laws that still criminalize and punish suicides in Kenya as one way of reducing stigma associated with this aspect of mental health care in the country. This is just one of the ways that local and global actors hope will help reduce the number of people affected by mental health issues that currently stands at close to 1 billion people globally. Brenda Wanga, Citizen TV, Nairobi.